Roughly 35 hours after the trigger shot, it is time for the egg retrieval. This is a minor invasive surgery, and anesthesia will be used. Make sure to have someone with you who can drive you home.
The patient essentially is going to come to us on the verge of ovulation, and we're going to do a very quick procedure. Some call it surgery, and some people refer to it as the retrieval. But whatever you want to call it, we're going to do that retrieval procedure, and that's where the patient's putting their complete faith in us to not miss an egg.
On the day of your retrieval, we tell you exactly what time to come in. We'll walk you down to the surgery area where you'll prepare. Your partner's able to come with you, which is nice because I think patients are really nervous on the day of their retrieval. So you meet with the anesthesiologist and they review the medications that they're going to give to you prior to the retrieval process.
The patient's going to receive mild anesthesia where they're going to be comfortable and asleep. And then an ultrasound is going to be used, where an ultrasound is going to help us visualize the follicles, and a needle is going to be used very carefully. Typically, the thickness of a blood draw needle is going to be used to aspirate or suck out the contents of each follicle. During this 5 to 8 minute process, the patients typically feel no pain, they're very comfortable, they're often at twilight-like sleep.
It's very, very quick. You're actually only in there for about 15 to 20 minutes before you're being rolled out back into the recovery area. So after retrieval, you should expect to get your next period about 10 to 14 days after.
We do tell every patient that anytime you have any procedure done, there's risk of bleeding, pain, and infection. We always give patients pain medication after the process in the recovery room, and we monitor them. Most people only need Tylenol when they go home. We always give patients antibiotics just to prevent the chance of an infection. And we always tell patients that if you just don't feel right, let us know.
We do advise no sexual intercourse for two reasons. One, you can still get pregnant. There may be some follicles that were not retrieved. There is that, which wouldn't necessarily be a bad thing, but just not the right time. The other major reason is for infection. We don't want you to introduce anything that could cause infection after your surgery.